The Covid-19 vaccination rollout is the largest medical event the world and New Zealand has ever experienced. We have a clear plan to ensure everyone aged 16 and over will be offered a vaccine by the end of the year. We are progressing well against the plan, which will see us steadily and then significantly ramp up the rate of vaccination as the year goes on. Rolling out a vaccination program of this magnitude is an enormous undertaking, and it's complex. We will face real challenges over the coming months, and I'd like to thank everyone who's involved. We couldn't do it without you. It's important to remember that we will have enough vaccine for everyone. To achieve our aim of having everyone vaccinated by the end of the year, we do need New Zealanders to work with us, and in some cases, to be patient. Collectively, DHBs are on track to deliver more than 1 million doses by the end of June. This aim aligns with the rollout plan, which follows a risk-based approach for providing access to the vaccine. By then, we will be well into vaccinating the 1.7 million people we've identified in Group 3. This group includes those in our populations over 65, people with underlying medical conditions, and our prison staff and the prison population more generally. But at present, our focus is on vaccinating the estimated 480,000 people in Group 2. This includes high-risk frontline workforces, staff and residents at aged residential care facilities, older Māori and Pacific people cared for by whānau, and the people they live with and their carers. This group also includes anyone who lives in Counties Manukau DHB area who is aged 65 or over, or has a relevant underlying health condition or disability. The 3 DHBs in Auckland are gearing up to start vaccinating this group from next week. Vaccinating staff and residents at aged residential care facilities is already well underway at the moment. There's some great success stories here in Wellington, where last week the Capital and Coast DHB vaccination team visited 4 aged residential care facilities, vaccinating 360 residents and staff. A 101-year-old resident was one of the first residents to be vaccinated. This week, the vaccination team will visit a further 7 facilities. All 42 aged residential care facilities in the Capital and Coast and Hutt Valley DHB region are on track for their first dose by Friday, 14 of May. The DHB is vaccinating in partnership with community pharmacy vaccinators. It's also that time of year when many people, especially seniors, are getting the flu vaccine. The Ministry of Health recommends a 2-week gap between the influenza vaccine and COVID-19 vaccines. Factoring in when flu injections are being administered in our aged residential care facilities is a major consideration for teams of COVID vaccinators. In my capacity as Minister for Seniors, I visited the Malvina Major Retirement Village in Kandala last week. They are offering their residents the flu vaccination first, so 14 days later, the residents will be offered their first dose of the COVID vaccine, and around day 35, their second dose. It's important that we have a well-trained and sustainable workforce ready to tackle the long-term vaccination schedule ahead. Outside our regular vaccination workforce of general practitioners and pharmacists, we're planning for an extra 2,000 to 3,000 full-time vaccinators. They'll be trained and available when needed throughout the country. General practice and pharmacy will play an important role in COVID-19 vaccine delivery, particularly as we roll out to seniors and people with pre-existing conditions who often have a strong connection with primary care. From July this year, as we move into Group 4 and begin immunising our general population against COVID-19, our vision is for more general practices, pharmacies and other care settings and urgent care facilities to be able to fully participate in delivering the COVID-19 vaccine. These brochures advising people which group they are in and how to make appointments for their vaccinations are being distributed to all households in the country from this week, and some of you may have already received them. The brochure has a link to the Unite Against COVID website, where information on the vaccine program has been translated into 25 languages. A second link, also to the Unite Against COVID website, has information in 4 alternate formats, easy read, New Zealand Sign Language, large print, and audio. Finally, on Friday, I got my second dose of the COVID vaccine. It was a relief it didn't attract the same amount of attention that my first dose did. I would really encourage people not to hit the gym straight after getting the vaccine. I had quite a sore arm after lifting some heavy weights and a slight rash on my arm for a day or so. I felt a little tired, but otherwise I felt totally fine. I'll now hand you over to Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So just to continue on the vaccination theme before moving on to other matters, as at 11:59 p.m. last evening, 232,588 doses of the Pfizer vaccine had been administered. A total of 172,564 people had received the first dose of the vaccine. That's an increase of just under 32,000 from a week prior. And a total of 60,024 people have received a second dose of the vaccine and are now fully vaccinated. So in the past 7 days to 11:59 Tuesday 27 April, we administered 47,981 vaccination doses to people, slightly higher than the previous week's total, and overall DHBs are tracking to plan. We're also adding to our stocks of the Pfizer vaccine in the country. We have received around 685,620 doses into the country to date, and that's enough to vaccinate more than 342,000 people fully with both doses of the vaccine. To date, we've received 295 applications for access to early COVID-19 vaccines for travel reasons on compassionate grounds. 124 of these were approved, while 107 have been declined and 64 are still outstanding and being considered. We've also received 488 applications from Sport NZ, including Olympians and Black Caps, and have 7 applications from Ministry of Foreign Affairs and Trade for people who are needing to travel overseas for reasons of national significance. The Minister talked about our preparations for starting vaccination of those in Group 3, and just to note that people in Group 3 can expect to receive an invitation for a vaccine from their local DHB. There will be a staggered approach to this as we progressively make our way through this next group, which is 1.7 million people, so it is sizable. It will begin with those who are over 75 and then move on to those over 65, people with disabilities and people with underlying health conditions who are under 65. DHBs have got flexibility in how they respond to the needs of their local communities. For example, in Northland, we saw them being flexible yesterday in administering vaccine that would otherwise have expired to people to make sure that the vaccine wasn't wasted. And likewise in Northland, where communities are spread out and take some effort to travel out to, it may make sense to vaccinate whole whānau or communities, and DHBs have the flexibility to do that. The important thing is that people are vaccinated. Our national online booking tool is currently on track to be available from late May to support the rollout of this substantial Group 3. So if you are one of the 1.7 million people in this group, please do look out for regular updates on the Unite Against COVID-19 website or your local DHB website. A word now on the person who recently flew from Australia to New Zealand, having been in Perth during the lockdown period there. That person flew from Perth to Sydney and then on from Sydney to Auckland, as has been previously publicised. The particular case is the subject of an ongoing investigation, and I won't prejudice that by discussing specifics at this stage. But what I can say is that, in general, any person who enters New Zealand who is ineligible for quarantine-free travel is required to isolate for 14 days in a managed isolation facility and may be subject to enforcement action if they have breached their relevant air border order. If a person is convicted of breaching quarantine-free travel requirements under the air border order, they could face a fine of up to $4,000 or 6 months imprisonment. In this case, there are a number of questions still to be answered about what has happened. We are gathering all the facts and answers to those questions, and the facts that are gathered will inform any next steps regarding penalties that may apply. However, I can say that based on the information we have to date, the risk arising from this person's travel to New Zealand is regarded as low. They had not attended any of the locations of interest in Perth prior to travelling to New Zealand. However, while it has been assessed as low, it does provide an important reminder that our response, our overall COVID-19 response, relies on accurate and complete information from people, and people fully complying with all the measures that have been put in place by both Australia and New Zealand. And we don't want to be in the situation where the actions of an individual jeopardise the quarantine-free travel arrangements for everybody. Regarding case numbers, there are no new cases of COVID-19 to report in the community today. Our case, who was the airport worker from last week, all close contacts have returned negative tests. There are 2 new cases to report in recent returnees who are in managed isolation facilities, and 10 previously reported cases have now recovered, so our total number of active cases today is now 27. One previously reported case has been classified as under investigation following confirmation that they had already returned a positive result in their home country before travelling to New Zealand. So our total number of confirmed cases is 2,254. It was a milestone over the weekend where we passed a total of 2 million COVID-19 tests having been processed through our laboratories, and I want to personally acknowledge that milestone, the work not just of our laboratory workers and all those who are involved in getting those tests completed, but those who have done over 2 million swabs of people around the country, our GPs, nurses and many other workers who have done those swabs over the last more than a year. And of course, I'd particularly like to thank all New Zealanders who have been tested, and with a particular emphasis on our frontline and border workforce who are regularly retested.